Good morning and welcome to Strictly Business. I'm your host, Penny Font. This webcast features conversations with Louisiana's most influential CEOs, entrepreneurs, and community leaders, with the goal of providing insights, ideas, and inspiration to help you and your business grow. Strictly Business is brought to you by Neighbors Federal Credit Union, the East Baton Rouge Parish Library, and Insperity. Without their support, this project would not be possible. Before we begin, here's a brief message from each of our sponsors.
The East Baton Rouge Parish Library believes that a thriving business community is good for us all. That's why we help entrepreneurs start businesses with tools like Gale Business Builder. Keep commerce rolling by providing access to computers, printers, and free Wi-Fi at 14 branch locations. Get a library card. Grow your business at ebrpl.com/business.
Owning a business comes with pressure. There's a limit to what I can do and still keep employees engaged. Fortunately, there's Insperity.
They expand my HR capabilities exponentially,
Helping me with hiring and training while offering my employees competitive benefit options.
since I can focus on other priorities, my staff can thrive, and my business can grow. With Insperity, nothing seems impossible.
At Neighbors Federal Credit Union, we believe stronger schools build stronger communities. And with the generosity of our members and staff, we're making a difference. We've awarded 54 project grants totaling over $220,000 for on-campus improvements. We've provided 99 scholarships worth nearly $300,000 to help dreams take flight. And through our mascot checking program, we've donated an additional $560,000 in unencumbered funds to local schools. Neighbors Federal Credit Union. We are neighbors helping neighbors.
Thank you all. We want to keep Strictly Business as interactive as possible. So for those joining us live, here's an icebreaker question for you. Submit your vote in the comments and the results will be posted at the end of the webcast. This month, we welcome E.J. Kuiper, who was named President and CEO of Franciscan Missionaries of Our Lady Health System in May 2024. He has spent the last 20 years as a leader in Catholic healthcare, most recently with Common Spirit Health as CEO of the Midwest Division, leading 28 hospitals spanning 4 states, with 14,000 employees and 1,600 physicians. The Netherlands native is a fellow in the American College of Healthcare Executives and was recognized as one of 101 academic medical center CEOs to watch in 2023 by Becker's Hospital Review. EJ, welcome, and thank you for taking the time to join us this morning.
Thanks for having me.
You're coming up on a year in your new role. That'll be in May. What are the 3 most critical healthcare issues you're handling as the new top executive right now?
You know, I think like most health systems, workforce challenges is still near the top of the list, right? So we have embarked on a strategic plan where we really are emphasizing investment in our workforce. Healthcare is all about people taking care of people, right? So even though we have beautiful buildings and state-of-the-art technology, without a highly engaged, highly trained, and motivated workforce, we're not going to accomplish a whole lot. So that usually, typically, is top of the list. Secondly, we're monitoring very carefully what's happening at the federal level right now, right? We've all heard about the contemplated reimbursement cuts for Medicaid and other programs. And obviously, as we're building the budget for the next fiscal year and the strategic plan, which covers 3 to 5 years, we have to monitor that and try to influence policy going forward. And lastly, and very importantly, we focus on the overall patient experience. So we're looking at quality indicators and patient satisfaction scores and make sure that they stay in the top quartile, top decile in the nation.
Okay. In your time here so far in the Capital Region, what would you say are some of the key health issues that need to be addressed in our community right now?
You know, what's central to our mission, core to our mission, is access to high quality services for everybody in the community. So you and I are fortunate that we do have great access to high quality doctors and service lines, but not everybody is as fortunate, right? And so a really important part of our mission is improving access to make sure that the poor and the vulnerable part of our population is taken care of as well. And so that's a significant focus for us. It always has been, and it always will be.
Okay. What financial challenges do health systems like FMOLHS face today, and how are you positioning the organization for long-term sustainability? And then secondarily to that, how are you navigating the balance of providing that high-quality care that you talked about with the rising costs of healthcare delivery?
We obviously, like I said a little while ago, are continually focusing on our relationship with the federal and the state government when it comes to the Medicare and Medicaid programs, and make sure that those programs are sustainable. And we meet with the commercial payers as well, trying to partner with them on a focus around elevating the overall healthcare outcomes in our communities. We are very blessed that we are having a very strong financial year. We have done really good work over the last several years, turning around some strained financials in the years post the pandemic, but having a very strong year. And we have to make sure that we balance our portfolio, right? And so when we're looking at our various markets, Baton Rouge is our flagship market with our flagship hospital, the Lake, but we also have Lafayette with Lourdes, we have St. Francis up in Monroe, and we have St. Dominic's in Jackson. So as you kind of look at healthcare over the years and you go back maybe decades, having a balanced portfolio is important. And right now, the Baton Rouge markets and the Lafayette markets are very strong, and we're a little bit more strained in Monroe and Jackson. If you fast forward maybe 5 years, it might be flipped, right? So as a health system, we always like to balance things out. We also have to be careful that we're not trying to be all things to all people. So it probably doesn't make sense to do an open heart program outside of our flagship market. We're probably not going to do that in Monroe, right? So making sure that we can keep healthcare local, but trying to do that in a way where we can keep the cost affordable for the communities that we serve.
I gotcha. Let's take a little bit of a deeper dive on that. How are you and other hospitals and providers managing rising labor, supply, compliance costs, other things?
You know, it's operations one-on-one, right? It's a daily focus for us. We are fortunate that some of the premium contract labor has exited healthcare in general and certainly out of our health system. During the pandemic, as you recall, we had to bring in a lot of what we call traveler nurses, and that came at a very high cost. Now, we needed to do it because there were significant needs in our community, but that was not sustainable. And the only way the health system in general in the United States was able to make its way through the pandemic years is there were the CARES Act dollars that were coming from the federal government. They dried up immediately post-pandemic, and that's when you saw some financial strain in the system in general, and certainly our health system was not immune to that. So we have really done a good job focusing on supply cost, pharmacy cost, labor cost, and make sure that we monitor that, manage that on a daily basis. And it has put us in a really favorable place and position right now.
Great. Are there specific areas where the system is looking to expand or diversify its revenue streams to remain financially strong?
Yeah, and when you're in a financially strong position, you get regular phone calls from other hospitals or health systems that would like to become part of your family. Our focus foremost is on our current footprint, or our current family. We have about 18,000 or so team members right now and a couple of thousand medical staff members. And we want to make sure that we can properly resource where we are in our 4 markets currently. So before we would consider inviting others into the family and perhaps acquire health systems or clinics, we really want to make sure that we have enough dollars to do that. If you stretch yourself too thin and expand too rapidly, it could be at the detriment of the existing footprint. So we are fielding requests from time to time, but have, as part of our strategic plan, decided that we are going to go for organic growth for the next couple of years before we would consider inorganic growth via acquisitions.
Gotcha. Let's talk on the subject of partnerships. Let's talk about your partnership with LSU. How do you see that moving forward? Any changes we can expect there or growth?
It's been a very successful partnership, and quite frankly, one of the main reasons that I'm here was because of the LSU partnership. And it started, as you know, a little bit over 3 years ago, and I only see that partnership expanding and further evolving from here. We're in partnership with President Tate's team on a regular basis to expand our academic partnership, and obviously, as the premier athletic partner, we are looking at also taking that to the next level. So we're very happy with the partnership and are very bullish and optimistic about where it's going to go from here.
Sounds intriguing. What healthcare service lines in the Capital Region do you see having the most growth potential?
I would say, most of the service lines have the potential to grow, but the one that sticks out is oncology, cancer care. We have some really strong players in the market. And I don't have to remind you that one of those, Mary Bird Perkins, was a very significant partner for us up to a few years ago. And we're still partnering with them. But we are very keen on kind of going back and talking to one another and see how we can work together to elevate cancer care in general. And so if we have another discussion a year from now, I'm hoping that we have some good news to share on that front, because I do believe that there's a great opportunity to elevate cancer care across the Baton Rouge region and beyond.
Great. What are the biggest regulatory challenges currently facing health system, and how is FMOLHS navigating those?
We have a strong advocacy team that helps us navigate those regulatory changes and requirements currently. And some of those requirements that come down from the federal level come from a good place, but sometimes have unintended consequences. For example, I'm thinking about behavioral health, mental health, where we have such a need in this community to create access for those that are struggling there. In acute care mental health facilities, over the last several years, anti-ligature policies have been passed down, and for all the right reasons, right? There are some patients across the United States, a handful or so, that die because they hurt themselves because they had the opportunity to do so while they were an acute care patient. So it came from the right place, but it's very expensive. Those anti-ligature measures can be extremely expensive into the millions. So the unintended consequence has been across healthcare that a lot of health systems have decided we can no longer afford to do this. We can't afford to invest millions into the infrastructure while the reimbursement is very low. And so I think what we talk about with the legislators is what are we trying to accomplish, right? And in mental health, I believe the main goal is to provide more access to those that are suffering, that are in need. So those are, there's an example of a discussion that we have with our federal partners around where it might make sense reducing some of these requirements in an effort to improve the overall outcomes.
Okay. We're in an immense period of transition right now on the national level. Are there any impending federal or state policy changes that could significantly impact hospital finances, patient care, any other aspect of the business?
Well, for sure. We're hearing about $880 billion in expense reductions in healthcare. And you can imagine that if that were to unfold, that is currently being contemplated, that it would have dire consequences for healthcare in general. And I feel blessed that I'm part of a healthcare system that financially is very viable, but I can't help but think about a lot of the independent, smaller systems and hospitals that may not have the financial reserves to sustain a 10, 15, or maybe even a 20% reimbursement cut when it comes to Medicaid or 340B. And so we are actively engaging with our federal legislators, and we have, like I said earlier, a really good advocacy team. In Louisiana, we're in a pretty unique position that the Speaker of the House and the whip in the House for the Republicans are from Louisiana. So we do have people when we call that pick up the phone and are good people and are open to our feedback. You know, we are very open to and understand the need to balance the budget and to reduce waste and fraud. We're very much in favor of that, but we want to make sure that the cuts do not impact the access to high quality care that we just talked about a few minutes ago. So the short answer is yes, there's a lot on the line right now, and a lot more coming, I'm sure, over the next couple of months.
A lot of good insights there. You touched on this a little bit in your previous answer, but what role does the system play in helping to shape healthcare policy at the state or national level?
Advocacy, right? We are continually in contact with the state and federal representatives, educate them on intended and unintended consequences of reimbursement reductions, programs that might be going away, and just explaining that the impact of, for example, a 340B program, if that were to go away or would be cut, really has an impact on our ability to invest in community benefit activities, right? And that's what that program is all about. It's a pharmacy cost reduction program. And as a not-for-profit health system, we then use those dollars to invest them right back into the community. So if those dollars would go away or would get cut in half, it will have a substantial impact on what we as a health system can do, and certainly our colleagues across Louisiana can do if that comes to fruition. So a lot of discussion about that, and again, we'll have to wait and see how that unfolds.
Absolutely. So stepping back from what's going on right now, just kind of overall, what changes would you like to see in national healthcare policy that would benefit health systems like yours?
I think partnering with Medicare, Medicaid, and the commercial payers around quality outcomes and really making sure that everybody has skin in the game. So agree on 3 or 4 things that we all jointly are trying to accomplish, identify those perhaps through a community benefit exercise, and then a reimburse health system based on the quality of care that they deliver based on those metrics that we all agree to. There's some of that happening already, as you know, in the Medicare and Medicaid program, and certainly we have that in partnerships with the commercial payers, but I do believe that we could and should take that to the next level.
Makes a lot of sense. Let's shift gears a little bit and talk about technology. So how is FMOLHS using artificial intelligence and automation and other, any other things you might be using to improve operational efficiency?
Sure. Well, we have state-of-the-art technology across our footprint, certainly here in Baton Rouge, but also in our other markets. When it comes to artificial intelligence, our philosophy is we want to be on the leading edge. We don't necessarily want to be on the bleeding edge of AI. But there's some really exciting projects that are happening right now, in particular around ambient monitoring systems. So as you can imagine, we're piloting some of these things. As you can imagine, a proceduralist, it could be a cardiologist, or it could be a surgeon who walks into an OR and is communicating with the nurses and the techs during the procedure, and the AI system picks up the communication that's happening and then is putting that into our EHR, our electronic health record. And so instead of having to, as a surgeon, having to spend 15, 20 minutes on writing the note is written and all we have to do is edit things along the way. We're piloting some of that. We're not quite there to fully deploy it, but the early feedback has been phenomenal. So we see that as an efficiency mechanism. Now, it's not to reduce the workforce or anything like that, but what we'd like to do is for our clinicians to spend less time entering stuff in a computer and more time face-to-face with the patient. So it's exciting, and it's going to evolve and develop quickly over the next couple of years.
Definitely a lot of exciting potential for efficiencies there. How does the system evaluate the return on investment when implementing new medical technology?
We have great financial staff that typically run the business plans, right? So they simply look at the expenses, what is the acquisition cost of the technology, and how would we deploy that, and how would that tie to reimbursement that would come in. And so we look at it from a financial perspective. The financial bottom line is not unimportant. But at FMOL, the bottom line goes, well beyond the financial bottom line. And so part of the ROI for us is the return on the investment is really how would that impact the community? Do we advance the quality of care in the community? Now, if we can do so and keep it in the black where we can actually make a little bit of money and reinvest it into the community, that's great. But we sign off on a pretty regular basis on technologies that will be in the red for a while until it further develops and evolves. So our business development team looks at all of these proposals, and then we decide as a senior team it's the right time to invest, or we're going to hold off for a little bit. So that's typically the process.
Okay, thank you for sharing that. So in addition to AI, the big conversation in healthcare seems to be around big data and predictive analytics to improve decision-making in patient care. How is the system leveraging that?
Yeah, big data is very important, in particular when you're able to aggregate a large number of patient encounters, right? And so we have the Epic electronic healthcare system. So we have very smart data analysts that do a lot of data mining and then are looking for themes, clinical themes, in a longitudinal way. So you're looking at it over a number of years and then decide whether or not protocols, procedures will have to be tweaked according to what we're picking up out of that big data. So, all health systems out there right now of a certain scale and scope have now very smart people managing all the big data. And data, as you know, is interesting, but if you just look at data and you don't get takeaways from it, then it's just that, a whole bunch of numbers and metrics. And so you have to make sure that you have the right team in place that actually can make sense of it and say, here are the 3 or 4 takeaways and things that we should consider changing going forward to optimize the outcomes.
Yeah. I want to go back to something you said earlier about others reaching out to you to the system for partnerships.
Sure.
Are there opportunities for collaboration with other health systems in the region to improve regional healthcare, or is there anything in the works or under discussion or?
Always. I think there are always opportunities, in particular when it comes to the overall community benefit program and the needs assessment that we go through every 3 years as part of the federal IRS system. It's a requirement for not-for-profit hospitals. We do that in collaboration with our quote-unquote competitors. We tend to not really view the world as a zero-sum game, right? So a good day, a bad day for the general is a good day for the lake. That's not our philosophy, right? We're just really here to make sure that we take care of all the patients that choose to be coming through our doors, and that's our focus. And quite frankly, our hospitals have been overflowing, right? So volume is not an issue. Our main challenge is how do we actually take care of all these people that are seeking care in our hospitals. We are talking to several entities in the Baton Rouge region about partnering. And what we do is, you mentioned service lines earlier. What we look at our overall portfolio and see where could we strengthen the care delivered in Baton Rouge? And are there people, entities, hospitals, groups in the region that are already doing it really well and would like to have a partner? So we always look for symbiotic partnerships, where both parties benefit, and most importantly, the patients that we serve in the community benefit. So yes, we are talking to several potential partners.
Okay, sounds intriguing. We talked a little bit earlier about talent. So how is the system addressing the current healthcare workforce shortages? And then along those same lines, what successful strategies do you see health systems across the country deploying to attract top talent amid national competition? And then if you can, also touch on burnout in terms of retention. How are you and other health systems preventing that or addressing it?
Yeah, I'll try to take them one at a time because there were a few questions in there. So, workforce challenges. We believe that we have to swim further upstream, right? So we have to make sure that we're part of the pipeline of talent, and that's why we partner with LSU and FranU and Baton Rouge Community College and Southeastern and Southern, all these great academic institutions that we want to partner with because they deliver actually new graduates every semester who we'd like to bring into the FMOL and Lake family. But sometimes these academic institutions need some financial help to build to widen the funnel, right? And so we are partnering with all of those institutions to make sure that we have a pipeline into our hospitals and into our clinics. We would love to, and we do on a regular basis, attract talent from outside of the state. And that's all about being proud of the community that we live in, right? And so I'm still a little bit of an outsider, almost a year now. And I'm telling you, we have an incredible community. I love being part of this community, and I'm proud of the healthcare that's being delivered here. I'm proud of the academic institutions that we have here, and the restaurants, and all the great stuff that we can sell recruits on, right? So just like LSU is going after, 5-star recruits that might be from Mississippi or Alabama, we also go after our own 5-star recruits by highlighting really how wonderful this community is. So that's important. Internal pipeline, bringing people in from the outside. And then when it comes to challenges, what might hold us back is, I think it is probably not dreaming big enough, right? So I spend a lot of time, because I think it's part of my job, thinking about where do we want to be 10 years from now? And in order to get there, what kind of programs do we need to start? Who do we need to partner with to be able to successfully get to that goal 5 or 10 years from now?
A lot of great insights there. Thank you. So we've had a lot of headlines recently in terms of the sort of this tension between insurance companies and proper health care. We had a huge piece of news in Louisiana with the recent $421 million verdict against Louisiana Blue. Are there any implications there or messages for FMOLHS?
We're not directly involved in that settlement, right, because we have a self-insured plan. But obviously, it has pretty significant impact on Blue Cross Blue Shield, obviously, and therefore it might indirectly impact how we're going to partner going forward. What we typically do with all of the commercial payers, whether it's United or Blue Cross Blue Shield or Cigna or Aetna, is every 2 or 3 years we sit down and we talk about what is a fair reimbursement structure, right? And, there's a little bit of push and pull, right? And so we obviously usually indicate, hey, our labor cost has gone up by 5 or 6% or 7%, or during a pandemic, 15%. And in order for us to be able to continue to deliver high quality care, we're going to have to be reimbursed accordingly. And, the commercial payers on the other hand are saying, well, our bottom line is only this much and we can only reinvest so much. So it really is, while we are negotiating, and you could argue that you're negotiating against each other. It typically is, how can we come together and figure out a way to jointly deliver the highest quality of care? And the reality is that we need one another to be successful, right? So we've had a history of good relationships with the payers, including Blue Cross and Blue Shield, and I'm looking forward to advancing that going forward.
Thank you. That's interesting. As we close out, you mentioned a 10-year plan. What are your long-term aspirations for the system in the next decade? Talk to us a little bit more about that.
I think it's growing, right? And the reason we want to grow, we're currently north of a $4 billion system, and we probably want to get to something north of that, 5, 6, 7 billion. And as I told you, in the first couple of 3 years or so of our strategic plan, we believe that we can do that organically by just investing in our current footprint. At some point, there may be an opportunity that comes to us where we say, hey, we are going to acquire this group, that practice, this hospital system. But I really don't want to actively seek that out. We have a lot of work to do investing in Louisiana, in Baton Rouge. The pandemic has slowed down some of the investment in capital projects, and we're excited over the next couple of months to announce some really exciting projects.
Well, we're excited to learn more about those. Do you have anything else you'd like to share with us?
I want to thank you, first of all, for giving me the opportunity. And I just want to remind everybody listening that Franciscan Missionaries of Our Lady has been around for well over a century. And I get reminded by the wonderful sisters that I work for, my bosses, that we plan to be here for another 100 years, right? The lake just celebrated the first 100 years, and we really are focusing on the next 100. And I think it's wonderful that there is a health system as part of this community that has shown, that has a track record of a commitment to high quality care through ups and downs, right? And regardless of what's happening in DC or in Baton Rouge, you know, we stay close to the mission. We know exactly what we're called to do. And I think as a community member, that would give me a lot of peace, even when you hear some unsettling news from time to time.
Absolutely. EJ, thank you so much for making the time to join us today.
Thank you. Really enjoyed talking to you.
And thanks also to our viewers for tuning in, as well as our sponsors, Neighbors Federal Credit Union, the East Baton Rouge Parish Library, and Insperity for making this experience possible. Please join us again for the April 16th episode of Strictly Business. Until then, on behalf of our show's director, Tim Coles, and I, enjoy and make your day a great one.